Hi, this is Carolyn Robinson doing my wound care video for our lab checkoffs in nursing school. So to get started, we are going to check our physician's order and perform hand hygiene. Walk in the room. Hi, I'm Carolyn. I'm going to be your student nurse today. Can you confirm your name and date of birth for me? And then I'm going to explain to them that I'm going to be changing their wound dressing today, and that it might be a little bit uncomfortable. Should take about 15 to 30 minutes. I'm going to assess for any allergies to latex, tape, antiseptics, any medications that they may have. And then I'm also going to assess their pain level and make sure that I give them pain medicine 30 minutes prior to the procedure. So then we're going to gather all of our supplies and prepare what's needed. So you have your bottled sterile saline or saline syringes. You also have tape, your wound measuring guide, 4x4 gauze package, dressing change tray, sterile gloves, non-sterile gloves, a cotton tip applicator, and a surgical or abdominal pad. So then we're going to perform hand hygiene again and reassess for pain. Then we're going to provide comfort and safety for ourselves and the patient. And that would include raising the bed to a comfortable working height for the procedure, and also assisting the client into a comfortable position that provides easy access to the wound, and we're going to provide patient privacy. And then we are going to place a biohazard bag. I don't have one. But we're going to place that in a comfortable or in a position that's within reach. And then we're going to perform hand hygiene again, and we are going to apply clean gloves. Okay, and so after that, we are going to start loosening the edges of the tape that's already around the wound. I don't have a wound that's already pre-done, but we're going to start at the edges of the tape with the old dressing. We are going to make sure that we stabilize the skin with our other hand while pulling the tape in the opposite direction. And then you would remove the layers, lifting the dressing from corner toward the center of the wound, and you would use moistened saline before completely removing if the dressing was sticking. We're going to observe the removed dressing for drainage, noting the amount, color, odor, and consistency. And then we're going to dispose of that soiled dressing and gloves in a biohazard receptacle. So then we are going to assess the wound by obtaining a culture. We're going to note the stage, the size, including the length, the width, depth, any undermining or tunneling. While we do that, we're going to use the face of a clock to document the position of any undermining or tunneling. We're going to note the exudate, the pain level of the wound, the edges, the site, the surrounding skin, whether or not there's any infection, and we're also going to assess the wound bed itself. Then we're going to perform hand hygiene again, and we are going to open the sterile dressing supplies using sterile technique. So with the thing, we are going to make sure that we only touch the outer corners. I can't see them very well. Okay, and then we are going to place that. Okay, so we have removed our sterile gloves, and then we are going to drop the contents of the wound tray onto the sterile field with any other essential sterile items. So I want to be sure not to contaminate the sterile field. Okay, now that we have all of our sterile items onto the sterile field, we are going to apply normal saline, either from a bottle or a pre-filled syringe, onto the 4x4 gauze in an empty dressing tray using sterile technique. Okay, so we're going to make sure that that's saturated, and if you were to touch any of the gauze or anything like that, it would be unsterile, and you would have to get new stuff. Okay, so next we are going to put on our sterile gloves using sterile technique. So we are going to open these this way, making sure to only touch the outer edges. And then when we go to put on our first glove, we are going to grasp the folded edges of this glove and slide our opposite hand into the glove. We're going to make sure that we lift the glove away from our body. And make sure that our fingers don't touch the sterile portion of the first glove. So to pick up our second glove, we are going to go under the cuff and slide our fingers into this glove. And at this point, if we need to fix anything, we can adjust the comfort and fit. Okay, so next we are going to use our saline moistened sterile gauze to cleanse the wound, clean to dirty. We are going to go from we are going to go from clean to dirty and top to bottom. So we are going to initially cleanse the wound by going on the incision line first, going from top to bottom, and then we're going to use a new one each time. And then clean the other incision line going from top to bottom. And then each used gauze pad is going to go into our biohazard receptacle after each section was cleaned. Remembering that we went top to bottom, clean to dirty. And then we are going to remove our sterile gloves and perform hand hygiene. Okay, so now we're going to perform hand hygiene, and we are going to apply our wet to damp dressing. So again, we're going to perform hand hygiene, establish our sterile field, maintaining the principle of a sterile field. Anything below the waist is unsterile. The sterile field is always in the side of vision, which I have it right next to me. And we are going to keep sterile gloved hands above the waist, and we're not going to reach across the sterile field, and we are not going to use a wet or damaged package of sterile supplies, and we know that we can't touch any unsterile objects while we have our sterile gloves on. Okay, so now we are going to open our sterile gauze packs and surgical pad. So here is my surgical pad, and this is my sterile field. Okay. And so we are going to open it and place it on our sterile field. And so the amount of gauze that we will need will depend on the size of the wound, and how much gauze we took out. So then we are going to again apply sterile saline from a bottle or a pre-filled syringe onto our 4x4 gauze pads using sterile technique. We didn't contaminate any of our sterile fields. We didn't reach over any of them. And then again, we are going to perform hand hygiene and apply our sterile gloves again. So again, we take the cuff of the first glove and slide our fingers into it. Making sure that we do not touch the outside of the cuff, making sure that we don't touch the sterile portion of the glove, and we only touch the outside of the cuff. And then to put on our second glove, we are going to reach under the cuff and slide in our opposite hand. And then once that is on, you can adjust to comfort. You want to make sure that you don't put the gloves towards your body or below your waist, because then you are contaminating the sterile field. And then, okay. And now we are going to make sure that we wring out any excess moisture from the gauze before applying it to the wound. Okay, so we're going to wring out any excess moisture. And then we are going to place the gauze in all of the depressions, crevices of the wound. And then if we need to, we'll use sterile forceps or a cotton applicator to ensure that the deep depressions or tunneling are filled with the gauze. And then we are going to apply a secondary moist layer over the first one. And then we're going to repeat that process until the wound is completely filled with the moistened sterile gauze. Since I am doing this on a picture, we are going to say that it is full after one. We're going to make sure that we don't pack the gauze tightly. And then we are going to make sure that it does not extend to, or it does not extend the moist dressing onto any surrounding tissue. And then we are going to cover the wound with, or the moist gauze with our surgical pad. So like that. And then we are going to dispose of our gloves and sterile field into or we are not, before that, we are going to secure the dressing with tape or any straps. So secure that with tape onto the wound. Okay. All right. So now that the dressing is secured with the tape, we are going to dispose of our gloves and our sterile field into the biohazard receptacle. We're going to perform hand hygiene again, and we are going to place the date, time, and our initials on the dressing. And then we are also going to thank our patient and assure that the bed is put back in the lowest position and is locked. We are also going to make sure that they have all the items that they need within their reach, and assess for pain one more time, and ask them if they need anything else, and then we are done. Thank you.